Thank you. Welcome everybody to this prestigious occasion, the launch of the report of Carol Black's second part of her review of drug treatment and recovery. So I'm Mark Davis, I'm the Director of Population Health at the Department of Health and Social Care, and I've been asked just to introduce this. I am told that you can remove your masks when you're sitting down, so there we go, mask removal. But put them back on again when you stand up, obviously. I'm just going to say very few words to start with. Thank you, everyone, for coming, and thanks to everyone who's online. It's great to see everyone here. I want to say a particular thank you to Carol for the massive amount of hard work and dedication that she's put into what I really hope will be a landmark piece of work. I think it's a fantastic piece of work. She and the team have worked tirelessly, quite a large team, but a very committed team, worked tirelessly to get this to this point, and it's great to see actually a printed copy, which you don't see very often these days, one for you to take home with your party bags, I guess, to enjoy at home. I'm not going to say much more because we're going to have, Carol's going to speak about the report, but I'm going to start by asking Minister Malthouse, Minister of Policing, who's on screen and in Gloucestershire, I think, at the moment, to say a few words, and then after that, I think it's over to Carol. So I'll leave it to you, Minister. Thank you.
Thank you very much indeed. And I'm sorry that I can't be with you in 3D. As you said, I'm down in Gloucestershire, working on another one of our crime initiatives, our acquisitive crime integrated offender tagging programme, where we're putting GPS tags on the ankles of acquisitive criminals released from prison to encourage them into a life of truth and light rather than a life of reoffending. But I was very keen to come and, first of all, welcome you all to this fantastic event and this, what I hope will be a seminal moment in our approach towards drugs. It's been very encouraging to see from the guest list the wide range of partners that are in the room, many of whom play a vital role in delivering services and helping us, frankly, develop our policies and improve our approach to improving the lives of our fellow citizens who are blighted often by drugs or indeed other afflictions. And whether it's treating people with substance misuse or even just supporting ministers, we do value your contributions. So thank you for coming along. But I'm also particularly keen to say hello to Dave Carroll, whose work over the last 3 years I've tracked in my capacity as Policing and Crime Minister, but also as the lead on drugs in the government. We've had lots of conversations during the process, and I'm very aware of the diligence and commitment that she's shown in putting together what I think is an incredibly insightful pair of documents, giving us an indication of where we need to go for the future in dealing with this issue. As you may recall, part one of the review laid out for us in, frankly, horrific detail the extent of the drugs problem in this country, a market worth conservatively £10 billion, 3 million, although possibly more, users of powder cocaine, 300,000 people addicted to heroin and crack, drug-related deaths tragically at an all-time high, and a supply chain into the country that was A, increasingly sophisticated and businesslike, but B, also increasingly violent and exploitative, with a drugs market that's driving almost half of all murders in this country and certainly half of acquisitive crime. So the picture was a stark one, but it also closely linked drug use to deprivation and indicated to us how critical our policies in this area are towards our levelling up agenda. And so part two, which you're focused on today and which I'm looking forward to getting to grips with, focuses on some of the solution to that problem. Treatment and recovery in particular, which I think we all agree are so important. We're doing lots on supply and restricting supply in drugs in my part of the business, and successfully so, as we drive down, for example, the number of county lines spreading drugs and misery into our provincial towns and villages. But we have to suppress demand. and alongside. And we have to turn the tide on drug-related deaths in particular, cut crime, and then reduce deprivation as a result. And we will do this by making sure everybody has access to high-quality treatment and the wider support they need to deal with their addiction and turn their lives around. So it's a big congratulations from me to Dame Carol and her team for getting to this momentous moment. I know they've put their heart and soul into making sure they've got a document that will sing to all of us and get some purchase in our policy making. It's filled with evidence, treatment and recovery, and it's been the product of a lot of, I think, collaboration and work with skilled and knowledgeable teams. I know a lot of civil servants have contributed from across the drug misuse sector. And I know, for example, Dr. Ed Day, our recovery champion, has contributed, as has my old friend Keith Humphreys from Stanford, who's been an enormous influence on my thinking in the area of crime and addiction. And also, frankly, I know there's been a lot of input from those who've had lived experience of addiction, who have contributed significantly to the report, and indeed, hopefully will contribute to the improvement in drug services in the future. From my point of view, I'm one of those people who's seen the effect of drugs in my life, albeit not happily in my family. Many years ago, I started my career as a property developer in the West End. It was a sort of vaguely glamorous life. But in the building opposite our office, there was a young man working for a financial analysis company who we got to know very well. He was sharp and funny and clever and had a career that was rocketing. He was doing incredibly well, but unfortunately, he had a drug habit. And over one particularly unfortunate weekend, he came across some substance, I still don't know what it was, that effectively caused permanent damage to him mentally, and he was never the same again. His career came to an end, and effectively he disappeared from our social circle, and I never saw him again. I still don't know what happened to him. And the thought of him, the effect that drugs had on him, comes to me every time I pass by Bolton Street, which is where the office was in Mayfair. And we know that this is an experience, or you will know as well as I do, that this is an experience that's felt up and down the land too often, and too often, frankly, tragically, in terms of people dying. Now, we've been very focused on this issue for a couple of years now, particularly from the supply point of view. We've been doing a huge amount, as I say, on county lines, on trying to restrict supply into particular parts of the country. But we haven't been waiting, if you like, for Dame Carol's conclusions of her report to come forward. We saw the drift, we understood the thinking, we agreed with that. And so in January this year, we did announce £148 million of new money investing into the drug system in 21-22 to try and help. So £80 million for treatment services, the largest increase in treatment for 15 years. That means we'll be delivering more interventions to reduce the number of drug-related deaths, and we're making sure drug users are in contact with the people they need, and indeed those who are in contact with the criminal justice system get the treatment they need to try and reduce their offending. We put £40 million into particularly focusing on supply, trying to restrict that as well, more for county lines, as I said. We're expanding and building on our success there to try and drive that down. We've closed now 780 lines, I think over 5,000 arrests, and critically, over 1,200 people safeguarded, those who are particularly vulnerable and dragged into this awful trade. And we now have chief constables declaring towns across the land county lines free. Bangor in North Wales was the first to go. Kent, we've got Swale and Tunbridge, and there will be more to come. Norfolk, previously over 100 county lines, now down to under 10. We're having big success on supply. But we have also, as I say, been keen to do work on demand. And I hope, as some of you will know, we put £28 million into Project Adder. This was an idea, frankly, hatched by me and Blair Gibbs, who was the Crime and Justice Advisor at Number 10 until he moved on just a few months ago, which basically said that there are lots of organizations working on drugs, from health, from police, from local authority point of view and social care, indeed mental health and others. But too often they're working on different people in different places at different times. What would happen if we brought everybody together to concentrate on a particular geography and lever off each other to try and have an impact on the numbers? And so we picked 5 areas of the country that have, sadly, the highest rates of drug misuse and deaths: Blackpool, Hastings, Middlesbrough, Norwich and Swansea, where we could bring all those partners together, with the police restricting supply and other more therapeutic services then finding the space to go in and help those individuals sadly addicted to drugs. We are seeing, I think, a beneficial impact, certainly much greater working together from those organisations. And I'm hopeful that over the next year or so, we'll start to see numbers turn. Significant upturn in enforcement, but at the same time, really targeted, focused intervention, health, treatment, rehabilitation for those most significantly affected, which I think is both practically, from a target point of view, and morally the right thing to do. Alongside that, as I'm sure you all know or will hear, Dr. Day published his first annual report as our recovery champion in January. He's incredibly passionate, having spoken to him about the importance of recovery, and the work he's doing with advocates and others across the sector, I hope will mean that many more people can benefit from his outlook and expertise. It's certainly extremely welcome and giving some momentum to the cause. And then critically also today, as part of the launch, we're announcing the establishment of a new joint drugs unit in government to coordinate and drive a genuinely what I hope will be whole of government approach to this drug policy. It's not just a Home Office issue, it's everybody else. And the new unit, based in the Home Office, but nevertheless overseeing the whole of government's response to the review, bringing in resource, expertise from all those key departments to make sure that we develop a really coherent and strategic approach across all those areas that are so important to get on top of this problem: health, housing, employment, yes, enforcement, and criminal justice. They all play a part. And bringing in DHSC, the Home Office, the MOJ, DWP, MHCLG, it's more a question of which departments are left out rather than those who are going to be in. I will be the government minister with responsibility for the overall policy and working very closely with the unit, but it is an issue very dear to the Prime Minister's heart, and we'll be reporting directly through to him about our progress and the wider delivery of policy beyond just the Home Office enforcement-led approach. We think it's completely critical. Allied to this, we're also committed to working extremely closely with the devolved administrations in the home nations, Scotland, Wales and Northern Ireland, of course, to make sure that we tackle this issue on a UK-wide basis. The interconnectivity in our union is very apparent from a drug supply point of view. Many of you will have seen the story last year coming out of the NCA's brilliant Operation Venetic, where they bust a factory in Kent that was manufacturing street benzodiazepines for Scotland, for export, if you like, from England to Scotland, where they intercepted 27 million tablets in one factory alone. A huge impact that would have had if it hadn't been intercepted. At the same time, we're very conscious that Scotland in particular has a huge problem with drug-related deaths, the worst in Europe and amongst the worst in the developed world. And we are committed as a UK government to assisting Scotland and indeed Wales and Northern Ireland with those problems. I've held now a couple of all UK drug summits with my counterparts in the DAs, and there'll be another one in September where we can make sure that the ADDA project in England and Wales is allied with the Drug Death Task Force in Scotland and indeed with the Northern Irish government to make sure that we're all singing off the same hymn sheet, we're all learning from each other, and frankly that we're all pointing in the right direction, particularly on restricting supply. So there is an enormous amount of work going on, And much of that has been galvanized by the conversations that we've had with Dame Carol and her team over the last couple of years. We are very conscious, and as I said, the Prime Minister is very focused on the devastating impact that drugs has in too many neighborhoods across our country, and that too many families are losing, particularly young people, to addiction and sadly to death. And that it is our moral duty as a government to do something about that. And while there are often, sadly, in this debate, two binary opinions, one that says enforcement is a waste of time, and the other that says treatment or rehabilitation is too namby-pamby, we don't agree with either of those things. We think that both tools are more powerful when they're used together. And I hope I've outlined for you today that we are absolutely committed through the spending and resources we've put in so far, through the strategies that we've started to implement thus far, and I hope through the work of the new drugs unit, levering in all that expertise and capacity and commitment from across government, that taking Dame Carol's report, this seminal piece of work, we can all of us work together to build to a brighter, more drugs-free future for the generations that follow us. Thank you very much indeed.
Thank you, Minister Moorhouse. And later on we'll hear from Minister Churchill as well to finish off the proceedings. But I'm very pleased to now invite Dame Carol herself onto the to the stage to talk about her report. And I'm not sure we're having questions. I think there'll be an opportunity to have some conversations after we've finished all the presentations. So thank you, Carol.
Thank you very much. Get ready. Well, good afternoon to you all. And first of all, a big thank you to the Minister, to Kit, for his really comprehensive coverage of where we've come from and where we're going to. And he has been a tremendous support to me. And so it's a very good opportunity for me to say thank you. All of you who are in the room today have been instrumental in us making progress in various ways, and I just want you to know that. Of course, there are many, many people I should thank. I can't thank them all in detail, but I hope you'll forgive me before I start if I just say a few very special words of thanks to some very crucial individuals. So, of course, it's my team, led by Tabitha, but we have Peter, John, Julia, Rebecca, Jez, Fiz, Tracy, Nino, and Emily, and I do hope I haven't left anyone out. But they've given me unstinting support, and we've had to do this all, as you know, at a distance. They and I have been really wonderfully supported by Mark Davis and Rosanna O'Connor, so to both of you, a huge thank you. And I personally owe a great deal of thanks to Donna Ward from DWP, who has been there for me through both reviews. My special advisors have always been there at the drop of a hat. At the number of Sunday mornings I've interrupted for Keith Peters, I wouldn't like to tell you, but that's when we normally talk, and it's usually early in the morning. And Ed has taught me what I know about recovery. And then in the room are some of my advisory board. So please can I say a very special thank you to you for being there for me and for being wonderfully supportively critical of what we were doing. And finally to Joe, to the Minister, you again have been there whenever I've needed you and have been really supportive. So just a few thank yous, and I'm sure I've missed people out. But what we're going to talk about is part 2 of this review. I hope you feel it's your review, because I certainly feel it's had so much input from so many people. So just to think about how we conducted the review, as everybody said, it is the second part of this review. I tend to think of the review as a whole because the first part really laid bare, and the Minister, Kit, has really told us about part one of the review, which, as he said, was quite a shocking story. And of course, while we've been doing part two, we've had to contend with the pandemic. And we know that that has widened inequalities. And if we do have a future recession, this will drive trends in drug use and death, we think, in the wrong direction. And we know very much that our problems are worst in our most deprived areas. So in part two, we've examined treatment and recovery in detail. And I think the simplest way of saying is the system we found to be broken and wanting. And I do feel that government must either now invest in a whole system. I don't want them to take bits of this review and drag it apart, because it won't lead us anywhere that we want to go. Or in fact, keep paying for the consequences, which, as the Minister said, is some £19.2 billion a year. The methodology was pretty standard and I think has served us well. A call for evidence, and we had some fantastic responses to that. 156 responses, and in fact they've been summarised and published with this review, and I know that you'll be able to find them online. And they were all, interestingly, nearly all moving us in the direction that we have gone. As I say, I've had always by my side Keith Humphreys and Ed Day. The reference group met 3 times, but I've had interactions with a lot of the members on an independent and individual basis, incredibly helpful. And then we've engaged lots and lots of stakeholders. In fact, probably having to do it all by Zoom meant people from around the country could actually just, if it was an hour and a half meeting, they could join us, which wouldn't have been possible if we'd been asking them all to come. So I think that gave us a very wide range of individuals. And I have to say, in part one, I learned an enormous amount from people with lived experience. And that has absolutely continued in part two. They teach us so much about what is needed, not why we think it's needed. Just if we could go back and just remind ourselves about why the review is needed and why we need to act now. I think the quality and quantity of treatment, none of us could argue that and recovery has declined, and the prevalence of use and harm have increased. And you can see in that very simple graph there that the years between 2013 and 2019 have not been good at all for those who are drug dependent. And you can see some of the facts that you all know, but I just would draw to your attention. Drug use among school-aged children has increased significantly, and a recent survey said that really 1 in 3 children had taken drugs in the previous year. Worryingly, the number of people going into treatment and staying in treatment has also decreased, and people not completing treatment has increased. So everything, you might say, is going in the wrong direction. And we have spent quite a lot of time worrying about the criminal justice side of this, quite rightly, thinking about how do we divert people from short prison sentences that may indeed not add any benefit, if anything, do harm, and then to make sure when you leave prison there are the right things in hand for you. As we mentioned, and the Minister mentioned, this is not evenly distributed around our country. Many areas have seen a doubling or even more in drug misuse deaths since 2010 to 12. And you can see there in the colour coding, the very dark, almost dark brown, 300% or more, coming down to 100%. London has, in some of its areas, done well, and you can see the areas up in the northeast and indeed down in the southwest, which have been faring pretty badly. And then the funding of drug treatment, we cannot run away from this, has decreased, and you can see that quite clearly here, whether we're looking at the part which is about all young people, the numbers in treatment and the spend on young people has decreased, and if you look at all adults, the same is true. So we've got a backdrop of increasing harm and widening inequalities. And this has been going on for some considerable number of years, almost certainly since 2014. And therefore, there's been a fall in the number of people receiving treatment and yet an increasing prevalence of use. And we have a great deal of unmet need, and particularly unmet need in the non-opiate group, which we really need to consider. So that's just putting it really into context. Of course, I'm not going to talk about all the recommendations. I said at the beginning I wanted no more than 12. I've completely failed. As you know, there's 32. But I tell myself that's not as bad as sometimes you see 100 or more. So, and some of them are quite interrelated. But I think the first important thing to say is this is about a whole system. And when you start to pull that system apart, bits of it will fall off. It's about a whole system change and underpinned by additional investment. And you see in the squares there the things that we consider to be really important, and some of them are very structural, such as government leadership. We absolutely need to have strong government leadership, effective local partnerships, and we know that they have fallen apart in the last 7 or 8 years, and clear accountability, which certainly needs to be strengthened. And then you'll see we have a box there for research and science. When we came to really ask ourselves where was the evidence base for what we wanted to do, in some areas, whether you're looking at, for example, recovery or at recreational drugs, the evidence base and the science are simply not there. And we do want to have much better research in science to inform policy. And then you can see all the squares that I think really are in my package that I call treatment and recovery. And I think if you start to knock one off, think it's not important, you will get a reduced result. And I can't say that too strongly. So in there, of course, there's evidence-based treatment, mental health and physical health care, which are strongly aligned to that. Recovery, we really have to improve what we do on recovery. Peer support is so important. And then sometimes people look at me aghast when I say good housing and employment support and say, how can this go into a treatment package? Well, I think for drug dependency, it does. And I'll come to that a little bit later. So whole system underpinned by additional investments. And we can't run away from this need for investments, so I thought I'd put it in fairly early on and acknowledge it and be quite straightforward about it. We need over 5 years, the analysts, and I've been deeply blessed in having people who've worked very hard to get these figures as close to correct. Of course, it's an estimate, and we all must bear that in mind. But we need 552 million for treatment, invested in treatment in the DHSC over 5 years. It starts in the first year, as you'll see from the review, at about 122, and builds up. To support employment, 15 million DWP would of course be the department in charge there. And then we know, although we don't have the exact figure yet, but work is certainly ongoing, ready for the spending review, that we have to be able to say what additional housing do we need? What does it look like? What is the support that's necessary? And we know that we've got to be able to include that. I suppose one of the most difficult things to say in one way is that this, in my opinion, must be ring-fenced. Because when you just put it into the public health grant, there are so many demands on local authorities that it could easily not get to the top of the list. So why don't we make it really easy for local authorities and say, this is to go to drug dependency and recovery and to nothing else. And you can see there the different departments of state and where the money flows. So it seems a lot of money, but even if we were to be able to secure this type of funding, then it really only takes us back to the sort of levels we were at in 2012. So a lot, but absolutely necessary. We say in the report that we need a central drugs unit, and of course the Minister has spoken about this. We see 6 departments that are absolutely essential for this unit, but there will be other departments, as Kit said, that we may need to ask to come in for certain things. But these 6 are essential, and if one of them decides to walk away, we will be diminished, and the programme will be diminished. Staffed by the relevant departments, a coordinating function, and the sponsoring minister reporting annually to Parliament, so the departments are held to account, both individually and the departments together. And we also need a new national outcomes framework that reports on the progress against this, and that national framework linked to a local outcomes framework, which will be created in a slightly different way. So it's clear to me that many departments in the past have tried, departments doing individual projects, genuinely wanting to be helpful, but actually out there on their own, not together, not supported, not with a minister, not with a unit, not with any analytical capacity for the whole thing. And if we really want to progress this agenda, then this is really what we need. And I'm delighted to hear what the Minister had to say about where we are already with this. But then we have this connection, and it has been difficult thinking about this, and we've had to do a lot of in-depth thinking about that relationship between the central cross-government drugs unit and the local authority, health and criminal justice partnerships. How do we ensure they really do relate to each other and communicate with each other? And you can see there are attempts to show how they join. So the National Outcome Framework obviously linking closely to the local outcome framework. But I do plead that when that local outcome framework is developed, then it is done in collaboration with the people on the ground. We shouldn't be doing this without really collaborating, talking with, and developing that local framework with those people, because after all, they're going to have to work with it. And then it can be used, if it's jointly owned, it can be used by the Office for Health Promotion to hold local authorities and other relevant local partner agencies to account. The enhanced public health grant conditions and requirements relating locally, requirements for partnership working. So this whole idea that there's not just the centre and the local without any connections, but that there are real connections and everybody is pulling in the same direction. although this slide is using quite a lot of the material that we've had in the previous two slides, I wanted a slide that put the individual at the centre. This is about every individual person who is coping or trying to cope or has given up the struggle of drug dependency. And you can sort of see all the things that they might need are around them. And they may not need all of those things, but they're certainly going to need quite a lot of them. And again, this means those departments which own some of these things are all involved. And I did just want to take some time to talk about a few of my circles there, because as we've done this work, some things have really sort of hit us in the face, and we think were not certainly given the attention they deserved before, and we really want to be sure this time they do receive that attention. The Minister spoke about the work of Ed Day, who has really been my teacher on recovery. And I've come to understand that whatever you put before recovery of the clinical services that you need, and of course they're crucial, the recovery can go on for a long time, and it will vary from individual to individual, but that there must be that capacity for that recovery to progress at the rate at which the person is able to progress. And when you think about if you have diabetes, I mean, at heart, I'm a medic, and I always think rather like a medic. But if you're looking after a patient with rheumatoid, I'm a rheumatologist, then they all don't take the drugs you want them to take at the right time. They don't all do your physiotherapy when you want it done. So you take them along their journey at different stages, and we accept that as being entirely normal for many physical conditions. Well, it needs to be normal for those who have a drug dependency. And Ed has really educated me on how much this depends on people with lived experience who play an absolutely vital role. And I must say, as we did the work, we thought too many of them were exploited as cheap or free labour, and we certainly wish to see that changed. Their passion and commitment as peer supporters was amazing, made a very strong impression on us. We also were disturbed by the number of small grassroots organisations that had perhaps not had the best run in the last few years, and that they had felt excluded in many ways, and yet they are particularly valuable. So you see, we've made recommendations in this area, and I'm sure you're all aware that, especially those on my advisory group, that we did worry considerably about the funding and commissioning of residential rehabilitation and inpatient detoxification, which had suffered an enormous cutback in the last 8 years. And then mental health care. I think this was the one that upset me personally most of all. I mean, if you look at that statement from one of the individuals we talked to, we can't treat your mental health until we've treated your substance use. We can't treat your substance, should be misuse, I suppose, until we've treated your mental health. But of course, this is one thing. I don't know of anywhere where you would say to a woman with breast cancer, well, we can't treat your breast cancer until you've got your hypertension under control, or vice versa. We don't do that. We would never dream to do that, but we seem to have no problem in doing that with people who have mental health or trauma underlying their problems, and also have a dependency problem. These are part of one thing. So many people fall between two stools, and much of that is in our own gift to correct. And that is why you will see the recommendation that HEE should develop competency and training requirements for all staff working with people with coexisting mental health problems, and drug dependency. I think there needs to be much closer working and a much greater preparedness to think that they could be helpful, more helpful to each other. I know it's difficult because the morale in the workforce is low, but mental health is so important if we're going to get on top of drug dependency, that this would be, for me, one of the very big asks as we move forward. And then I really wanted to say a word about employment, because I'm sure all of you here today are aware of the individual placement support trials, randomized trials that have gone on in 7 areas run by PHE and for DWP. It came out of the report that I did with Donna a few years ago on drug dependency and indeed, I dare say, hardly dare say, obesity and the benefit system. But in that, we recommended that this should be trialled. It takes a long time for things to be put into action, but these trials are showing good results. And they've been getting people back to work that you would have thought perhaps could never have worked. So many people who have suffered from drug dependency who said to me that if they get clean, there's a big black hole. And if you don't feel that was something meaningful to do, it's so easy to go back to their old friends and their old habits. So it is an essential part of recovery. Maybe not everyone can certainly find employment, but there are many things that are meaningful that we could help people move towards, and I think employment is most certainly one of those. And we have to work with employers because it's not always easy for them, and they are wary of hiring. So our recommendations there are mainly directed to DWP, and we hope that they will consider those recommendations kindly because they are crucially important. And then perhaps what is the most incomplete part of the review is the work we have done on housing, because as you see, we recommend that MHCLG and DHSC work together to gain better understanding of the types and level of housing-related need among people who have a substance misuse problem. We really don't know as accurately as we'd like to what this is, but we do need to be much better informed in order to feed into the next spending review. Drug dependency can, of course, be a cause or a consequence of homelessness and rough sleeping, and it is impossible, I think, to recover if you are living in a house where people are shooting heroin. You cannot, I don't think many of us could survive that. We would go back to our old habits. We really welcomed the additional funding that's already been secured to improve treatment services for people who sleep rough, and we know that the Housing First is an effective evidence-based model. You can see there that the housing status of people starting drug treatment is not satisfactory. Some of it is really urgent, some of it is a problem, and it is, of course, worse for those people who have an opiate dependency. So that I just wanted to bring out those 4 areas because they were areas that we spent a lot of time thinking about and areas we really want to see a change in as we move forward. And then, of course, we come to the workforce, and there's so much to do here. And, of course, you can't just grow your psychologists and your nurses and your social workers overnight. But we did identify deficits in certain professions, and particularly those delivering psychosocial interventions. And you can see there, of the psychologists, 51 were consultants, 164 practitioners, 32 assistants. But actually, we should have, in a good world, 1 consultant per local authority, 150. This just gives you a measure of just one group of professionals that we need. So I think we need an increase in the number of qualified drug treatment staff. And we also need to be able to set occupational standards and competency and training requirements for drug workers, peer recovery workers. It is important, I think, to think about the caseload, because if you have an excessive caseload, the quality of what you can offer someone naturally diminishes. And what we found in a workforce survey that was done in the summer of 2020, the average caseload for a drug and alcohol worker was 50, when we would like it to be 30. Some areas it went up as far as 80. So that gives you just a sense. But I don't think we should sort of throw up our hands in horror and therefore say there's nothing we can do. There are things that we can do, and with the help of Health Education England, I think we can start to make a move. Although it's not on the slide, the other thing we're trying to think how to do is how do we create a centre, a place for all those who work in addiction. I won't call it a faculty because there is already a faculty within the College of Psychiatrists, but that is of course a medical faculty. We were thinking of how do we provide a space, a centre, which could indeed have several functions where we raise the morale, give support to people working in addiction and make them think that they are highly respected, valued set of individuals who are doing a most incredibly needed job. So workforce issues. Young people, I mentioned at the beginning that we have a big worry here. 40% increase in drug use among children. You could see on the side that may not be too easy to read the sorts of drugs that children are using and the percentage change in some of those drugs, so that we know after years of a nice steady decline that has changed, and we really would like young children to be top of our agenda as we move forward. We've made some recommendations on prevention. It's a huge area. You could almost write a second report on prevention, but we have worked closely with the Department of Education, and we do have recommendations there. And also we're very aware that programs that support young people's resilience before they encounter illicit substances are very important, and that often that had been diminished because of reduced funding to local authorities. So out-of-school activities providing an alternative to drug use. And then we come to prisons, and really the key message there is can we, through appropriate diversion, provide some people who are drug dependent with an alternative to a short stay in prison, when indeed they might meet other drugs and find themselves in more trouble. They certainly will meet drug gangs and might get into the throes of a drug gang. And they leave prison certainly no better than they went in, probably worse, and it becomes a terrible hamster wheel. So we would very much like to see, the use of community sentencing with drug rehabilitation requirements increased. It has decreased significantly. But if we're going to do that, we have to have the good treatment, the quantity of treatment and recovery for these individuals to go into. Otherwise, it simply isn't going to work, and it's going to make the criminal justice system think it is no use considering diversion. But you can see referrals from the criminal justice system have just steadily reduced since 2010. And then we've worried about prisoners released from prison who have a drug-related problem, so often released on a Friday afternoon, which I think should be banned, because how do you get together all the services they need as they're leaving prison? And if they're leaving prison with no resources, their benefits not sorted out, nowhere to go and live, and their treatment not set up well, it's quite likely that they will be back into their drugs within just a few days. It's a very tricky area, that time when people first leave prison. I think, as you can see from the recommendations there are things that we consider would make an improvement. And then very finally, innovation research on addiction. John Strang, who's in the audience, knows this topic better than any of us, really. And we've talked to John a lot about the paucity of research and the paucity of support for research. And if you just take psychosocial interventions, particularly for cocaine and for the other non-opioids, or you take recovery, there's so much to do in this space. And we obviously would like to see policy made with research and the science in sight. And we are not in that position. And I think it would be fair to say that we're far behind some countries who do this much better than we do. So, of course, we have made recommendations in this area. That's a very fast canter through what you'll find in the report, but many of you already know a lot of this because you've been part of it. But let me end on a positive note, because investment in treatment over 5 years would see that for every pound we invested, we get an average saving of 3.5 in costs elsewhere. And you can see just one or two of the things that would be improved. So opiate overdose deaths prevented. By the end of year 5, over 3,000. Additional people in long-term recovery, 95,000, that's 3 times what it is now. There's a positive and wide-ranging impact. And I won't, of course, read that list to you. You will know them all only too well. And we know that after 5 years, increased investment would deliver additional opiate and or crack users in treatment and younger people in treatment. So I think there is something to be gained, a tremendous gain, if we can keep this whole system together and really try in the next few years to really try and do what is in the report. I really feel, having spent over 2 years doing these 2 reports, that I have been shocked by what I have seen in the drug dependent community, what they've had to put up with, their stigmatization, the fact that we don't give them parity with any other disease, and I very, very much want to see that changed. So many of these people need help, and we could simply do so much better. So I will stop there, but that is the report. Well, now, if you see me very elegantly go down from this stage, it's because I've had a knee replacement, and it's the first time I've dared to put on a suit and a skirt, and I don't have a completely full bend to my knee.
There you go. Well done. moment of mild peril over there. Thank you, Carol. Thanks very much. It gives me great pleasure to introduce Minister Joe Churchill, Minister for Public Health and Primary Care, to say a few concluding remarks. So thank you. Over to you, Joe.
Thank you very much indeed. And I'd like to say what a pleasure it is to see so many of you in the room. It feels like we've missed that human contact, and a lot of what Dame Carol was just talking about was our need to be better at human contact and human understanding. So thank you for attending today. I'm sure it has both been illuminating and challenging, but as she said, for many of you, you know a lot of this because you've stood by her on the journey to develop both part 1 and part 2 of the report. So thank you from us as well for the work you've done. I'm grateful to Dame Carol, but not surprised that she's produced such an insightful piece of work. My personal words to describe her would probably be energetic, inquisitive, and an incredibly good listener. She taught me how to listen to the bits that you perhaps need to know and hear the bits in the middle. From the initial commissioning of Part 1 in 2019 to the launch of these recommendations today, your work has been absolutely phenomenal. I would like to thank you for your dedication to this agenda, the time you've given me, and I know Kit feels the same, but also other ministers. Your commitment to making a difference was summed up. I can't sum it up any better than those final words. We can do better, and we should do better. This review, however, is just the latest example of your commitment to public health. So for the last 15 years, you've been giving us this good advice and independent recommendations across work, across health, across sickness absence, and now across the very difficult area of addiction. You've championed that evidence-led policy making and shown the importance of impartial experts to us. Your approach to the review also serves as a reminder of the importance of empathy in policy making. You note the financial costs, the huge financial costs to society from drug use and addiction, and you write about hoping to bring that change into individuals' lives who currently suffer from addiction. But as we all know in this room, it's not only that individual. As your diagram showed, it's their families, it's their communities, it's absolutely everybody around. Drugs wreck lives, and the availability of those drugs, as you explained to us in part 1 when we were in Scotland, and we heard about the funds and how that affects organised crime, violence, abuse, exploitation, and on and on. But you've also emphasised in your review that those harms are accelerating and getting worse. Deaths are at an all-time high, and as you articulated, this isn't fair. They are disproportionately distributed in areas of high deprivation, areas of health inequality, areas that perhaps don't have the resilience that some other areas do in order to fight back. We are in DHSC committed to taking action, and the review sets out that concrete evidence-based proposals for reducing the demand in illicit drugs, but also what the next steps need to be. The Office for Health Promotion, which is to be established in October this year, but is the extension of Public Health England and the change there into the UKHSA and the Office for Health Promotion, and the Joint Drugs Unit, which has been announced today, will be at the forefront of implementing the proposals and hopefully turning the tide on the harms that are caused by illegal drugs. But it's a really big hill to climb. Minister Malthouse set out in his speech how that addition of the additional 80 million has already been invested in the treatment services, which, as he said, is the largest increase that we've seen in the past 15 years. It does signal a point, a turning point, a moment for change, but also the start of something. Now, the increase in drug deaths, the burden of associated harms, shows harms from trafficking, but they also affect that individual who's in search of a fix, who they themselves will be at the hands of those who look to exploit, violence, abuse, and all the other challenges that then make coming back so very difficult. And it is that violence and that rise in inquisitive crime and so on that shows a different need for a different approach. I mean, 2.8 million crimes that go on, that affect families who may have left a window open or something like that, an elderly member of the community. And both of those people have a need to be sorted. But this is one problem that remains unashamedly tough on a strategy that remains unashamedly tough on those who supply or deal illegal substances. But we must provide the right safety nets, the right support to those struggling with addiction. A new strategy, as laid out, that works across government, that just isn't that individual silo working that Dame Carol said had been, for all the right reasons, tried, but had perhaps not joined up the dots. A strategy that provides support in the NHS, linking that physical and mental health and linking those practitioners with drug and alcohol services across prisons, across the probation services. The number of probation officers I have spoken to that have the care of those individuals but feel there isn't anywhere to go. To housing, to employment support. Addiction doesn't exist in an isolation, but is connected to a host of other factors. As the report shows, and as many in this room have talked to me about, it's about past traumas. It's about other things that lead an individual there. Now, our response to drug use and addiction needs to be based on the facts and respond to those complex comorbidities that often prevent and present, and the years of life that it deprives. We know many of these individuals don't make it beyond their mid-40s. That's a huge waste. It's a waste of life, but also for the families it affects. As a parent, watching other parents whose children are going through this journey, and we've seen the statistics, those numbers of children being able to access drugs is going up. So intervention needs to be smart and it needs to be early. We need to help young people before it gets there. We need to work closely with the Ministry of Justice, the Prison Probation Service, and it's essential to help the current cohort of drug users that cycle in and out of prison, and helping them whilst before we get there, helping in schools, helping provide those other areas where they can avoid drug use. That is why we recognise the importance of comprehensive addiction support services across the local authorities, increasing specialist service, particularly for young people with substance misuse problems, making sure that we are providing meaningful activities outside of the school space to help young adults that would otherwise just turn to drug and alcohol misuse. More treatment services, however, require a larger workforce. And 51 doesn't split very well into 150. So that's why we will work closely with Health Education England to develop those training requirements and set occupational standards for staff, drawing up an urgent comprehensive strategy on the future need of the workforce, improving the understanding of addiction and making sure we have the evidence to back it up. The review also called for new investment in research, incentives for new discoveries, and a focus on what underlies and drives that drug taking in the first place. We recognise the importance of the agenda and will seek to build on the excellent work done already by colleagues in PHE and across the UK's world-class universities, making sure that we can establish research where it needs to be. Dame Carol has always been committed to offering policy advice grounded in the best possible evidence. It's essential we support this by continuing to back research and innovation. If COVID has taught us anything, we don't always have to do things the same way. I'm looking forward to working with my ministerial colleagues on the Joint Drugs Unit and our next steps as a government, working closely together to deliver an initial government response in the next few weeks. And as Kit stressed, this has the support of Number 10 and the Prime Minister. I would, in conclusion, like to express my gratitude to Dame Carol for her work one last time and echo Kit in thanking everybody for their contributions. This was a huge piece of work. It is a huge piece of work to carry on doing. The review presents us all with an opportunity and a time for action, and to effectively deliver and make sure that we deliver for people on the government's ambition to tackle the harms from drug misuse that wreck lives and destroy futures. So thank you, Dame Carol.
Thank you, Minister Churchill. I think that concludes all the speaking for today, so thank you very much for attending. And thanks also to Minister Malthouse, who beamed in from Gloucestershire. And most of all, thank you very much, Dame Carol, for all this work, for a fantastic report. I hope it's the game changer that it needs to be. So it's a great piece of work, and thank you so much for that. And thanks too to the team who worked so tremendously well alongside you, and I know contributed a huge amount to the work. I'm afraid there's no time for questions, so but it is possible if people have any further comments or questions to email the Independent Review's mailbox, which is, I think, freely available online, so you can find it if I'm sure you have access to it. So just to conclude, we're having some refreshments next door, so if you will first of all finally just join me in thanking all the speakers today, and then if we move to next door for some refreshments. So thank you very much, everybody. Thank you.